say I agree with our chairs and our ranking member in terms of increasing, not decreasing your budget. And thank you all for your great work. I want to, a couple questions on the, all of U.S. research, the participant engagement. What percentage are your volunteers women now?
So the current, at about 206,000 participants, I believe we're slightly over 50% that are women. We have focused also on racial and ethnic minorities. About 50% of the participants are from those groups. If you include rural participation, which has also tended to be underrepresented in NIH research, where we've made a big push, we're up to about 75% of the people taking part in All of Us are from all of those usually not so well represented groups.
And on the clinical trials that where it's appropriate, what percentage of the participants are women now?
If you look at the aggregate across all of NIH, it's about 53% of clinical trial participants are women. Obviously varies from study to study. If you look at breast cancer, it'll be very close to 100, but not quite. If you look at prostate cancer, it'll be 0. But when you average across, that makes sense, right?
What about in terms of pregnant and breastfeeding women in terms of their inclusion?
That's a great question. And in fact, I'm going to ask Dr. Bianchi, because of this very important effort that's just gotten renewed for another phase, to answer about this.
So we know that over 2,400 pregnant women are already enrolled in All of Us. So I don't believe that they are specifically participating yet in any trials that are associated with medications, for example, but they represent a cohort who are actively involved and engaged in the research.
And you might say something about PRGLAC, which is an overall effort across NIH to try to be sure we are including pregnant women.
With the gentlelady, just for 1 second, about
Yes.
maternal, mortality.
Yes, I was going to ask about that, but.
Okay, go, you go.
All right, but if I don't get to it, since you used up some of my time.
Reclaim it.
I reclaim it from the chair. Couple things to follow up there. I know there've been issues in terms of nursing mothers, in terms of what can they do, what can they eat, what kind of medication. Is there research going on there? And then let me just, I'll ask the question on the maternal. I know there has been a increase on the mortality of women having babies, and maybe you could tell us where you are on that.
Yeah, so those are two big, different questions. So
Yes,
maybe I'll start with the medications.
I have more, too.
Okay.
All right.
I can only take one at a time, but
All right.
medications taken by pregnant and lactating women. So NIH chaired a task force that over the past year and a half examined, what is the status of knowledge known on the subject. And the bottom line is very little is known. Pregnant women take on average between 3 and 5 medications during their pregnancies. The assumption is that it's safe not to take those medications, but in fact we might be harming pregnant women. For example, if they have asthma and they're not taking their asthmatic medications, their breathing is affected and it will harm the baby. So there's a great need to know more and to leverage existing resources to find out what we know about pregnant women during pregnancy. We need to change the culture where women are excluded from research to specifically including them.
May I just ask you, do you need more funding in that area?
Should I be honest and say we never got funding? I mean, we never got funding for the task
So I'm
force.
just saying, so you would like to have some funding in that area?
Of course, this is an important area.
And if I could, I'm gonna yield back in a moment to our chair to ask about the mortality. But I do. Okay, you want to ask it? I have one more question on. Okay, okay, that's fine. I wanted to ask about heart disease. 1 in 3. It's the number 1 killer of women, claiming 1 in 3 every death. 289,000, I believe, women died of heart disease last year. I wanted to ask you a couple things on that. Will proposed budget cuts affect efforts in that? And what more could we be doing? I'm going to ask you also a positive. what more could we be doing in funding in terms to start to reduce the mortality?
Dr. Gibbons is on point for that.
Thank you.
Well, as you mentioned, heart disease is the leading killer of women in this country. For those women over 65, that's a burgeoning population that's at high risk. Certainly, it's not only increasing, but the risk of cardiovascular disease among women is also affected by race ethnicity. African American women are twofold higher risk of developing disease and mortality. So this is a major problem that needs to be addressed. We've learned a lot in the last few years related to the Women's Health Initiative. That's given us new insights to the drivers of cardiovascular disease in this important patient population. And we're seeing how we can prevent it, recognizing that the type of form of cardiovascular disease is different in women relative to men. And so we really need sort of sex-specific strategies to really prevent and treat more effectively. And we're doing trials to do that. One I'll mention quickly relates to the WISH study, where we found that even modest activity in women over 65, walking, gardening, reduces their risk of developing heart failure. And so now we're doing a trial to actually encourage women to undergo those lifestyle changes to improve their health outcomes.
Thank you. If you could, just maybe when you leave here, whatever, I would be interested in knowing if you were offered more funding in this area, what kind of research you would do.
Absolutely more that can be done.
Yes, thank you. And I yield back, Madam Chair.